Mr. President, I too want to, speaking in favor of this amendment, I want to thank the Chairman of the Finance Committee and the Chairman of the Subcommittee for their good work in putting this amendment before us. Mr. President, this is truly an historic opportunity, and we should seize this opportunity. For the first time in almost 50 years, we have a chance to expand Medicaid coverage significantly, up to 400,000 new citizens that will be covered up to, for those that income is up to 138% of the federal poverty level. These are people who now are not covered by Medicaid because they're not covered by any insurance. They're too poor to buy health insurance, and they're not eligible for Medicaid coverage currently. And the interesting thing is, and the exciting thing is, Mr. President, this is covered for the first 3 years 100% by the federal government. We're talking about billions and billions of dollars coming into the economy of the Commonwealth of Virginia. And we're saving funds from the Commonwealth, according to we found out now, $52 million in fiscal year 14. Mr. President, this is truly an opportunity that we must seize. The federal government will cover it entirely for the first 3 years, and then after that, no more. The Commonwealth will only have to pay up to 10% of the entire expansion of the Medicaid coverage. Mr. President, one of the things we need to point out, this not only helps the poor, it not only helps those that cannot now have health insurance and do not now have health insurance up to 138% of poverty, but it also helps those that pay private health insurance premiums, all of us, because it avoids the cost shifting. There's a hidden tax that I like to tell people in your health insurance premium, a hidden tax that's used to cover the uninsured, to cover the uncompensated care that is given out, provided by hospitals and by doctors. And this, by avoiding this cost shifting that every hospital administrator will tell you about, this is a benefit to the hospitals, but also a benefit to those that have health insurance premiums, because the private health care is covering that underinsured part and the uncompensated part. Mr. President, what this does is not only expand the economy of Virginia by over $2 billion or so a year, which is significant, going to hospitals and doctors and the health care providers, but it also will create, according to one study, 31,000 new jobs. This is a jobs program. If you want to look at it strictly from an economic standpoint, $2 billion a year and 30,000 to 31,000 new jobs to the Commonwealth of Virginia. Mr. President, this is obviously supported by all the hospitals, it's supported by the health care providers, it's supported by businesses, the Chamber of Commerce, and by the localities. Mr. President, I got a letter, since we're talking about letters from hospitals, from Carillion Clinic. The president's CEO, Nancy Agee, wrote a letter to me, and she may have sent a letter to many people. And she says in her letter, and I quote, "Medicaid extension is the singular most important issue that we have faced in my career." And I would suggest this is the most historic opportunity to expand health coverage, health insurance coverage to our citizens of Virginia that we've had since any of us have been in the General Assembly of Virginia. So, Mr. President, I would hope that we would seize this opportunity with enthusiasm and recognize it for the historic opportunity it is to expand Medicaid coverage and to provide more insurance and more coverage for citizens of our Commonwealth that cannot now afford health insurance and are not now covered by Medicaid. I enthusiastically support this amendment, Mr. President.
Thanks.